You trust your medications to improve your health. But are you aware that some may also influence memory and thinking? Here's what the medical evidence actually says. Knowledge is one of the best tools for protecting your health. By understanding how certain medications may influence the brain, you'll be better prepared to ask the right questions and work with your healthcare provider to find the safest treatment plan. It's important to understand one thing before we begin. The medications discussed in this video should never be stopped on your own. Many are essential for treating serious medical conditions and can significantly improve quality of life. This video is simply intended to help you understand which medications have been associated with memory or cognitive changes in some people, especially older adults, and when it may be appropriate to discuss those concerns with your healthcare provider. Now let's take a closer look at the medications that experts commonly review when evaluating memory problems. Point 1. Anticholinergic medications. Anticholinergic medications are among the most carefully studied drugs when it comes to memory and thinking problems. These medications work by blocking acetylcholine, a chemical messenger that plays an essential role in learning, memory, and communication between nerve cells. As we age, acetylcholine levels naturally decline. Because of this, older adults may become more sensitive to medications that further reduce its activity. Some allergy medications, sleep aids, overactive bladder medications, and certain antidepressants all have anticholinergic properties. Several large observational studies have found that long-term use of strong anticholinergic medications is associated with a higher risk of developing dementia. However, an association does not prove that the medications directly cause dementia. Researchers continue studying whether the medications themselves, the medical conditions being treated, or other factors explain this relationship. If you're taking one or more medications with strong anticholinergic effects, especially over a long period, it's worth asking your healthcare provider whether lower-risk alternatives may be appropriate for your situation. Point 2. Benzodiazepines. Benzodiazepines are commonly prescribed to treat anxiety disorders, panic attacks, muscle spasms, and insomnia. They can be extremely effective, particularly for short-term treatment. However, these medications slow activity within the brain. Older adults often experience stronger side effects, including excessive drowsiness, slower thinking, poor concentration, and temporary memory difficulties. Researchers have spent years investigating whether long-term benzodiazepine use increases dementia risk. Some studies suggest a possible association, while others have found no clear evidence that these medications directly cause dementia. Because of these concerns, many medical guidelines recommend using benzodiazepines only when necessary, and for the shortest duration possible, especially in older adults. It's also important to remember that these medications should never be stopped suddenly without medical supervision, as withdrawal can be dangerous. Point 3. Prescription sleep medications. Many people rely on prescription sleep medications after struggling with chronic insomnia. While these drugs may improve sleep in the short term, they can also affect alertness and memory. Certain prescription sleeping medications have been associated with temporary confusion, memory gaps, unusual nighttime behaviors, and an increased risk of falls in older adults. Current evidence does not show that these medications directly cause dementia. However, repeated episodes of confusion or impaired thinking can significantly affect daily life. For persistent insomnia, healthcare providers often recommend improving sleep habits and cognitive behavioral therapy for insomnia before depending on long-term medication, whenever appropriate. Point 4. Opioid pain medications. Opioid medications are powerful pain relievers, commonly used after surgery, serious injuries, or for certain chronic pain conditions. When used appropriately, they can provide significant relief. However, opioids also affect the central nervous system. In older adults, they may contribute to excessive sleepiness, slower thinking, confusion, and delirium. Delirium is a sudden disturbance in attention, an awareness that can sometimes resemble dementia. Fortunately, delirium is often reversible. Once the underlying cause is identified and treated, healthcare providers usually prescribe the lowest effective opioid dose for the shortest appropriate period, while carefully monitoring for cognitive side effects, particularly in seniors. Point 5. Certain older antidepressants, some older antidepressants, particularly tricyclic antidepressants, have strong anticholinergic effects that may contribute to confusion or memory problems. In older adults, newer antidepressants often have fewer cognitive side effects, but treatment decisions should always be individualized. Point 6. Overactive bladder medications. Several medications used to treat overactive bladder also block acetylcholine in some older adults. This may worsen memory or concentration. If cognitive symptoms develop, a healthcare provider may recommend alternative treatments. Point 7. Certain anti-seizure medications. Some anti-seizure medications may slow thinking, reduce concentration, or affect memory. These side effects vary widely, depending on the medication, dosage, and individual patient, so any concerns should be discussed with a neurologist. Point 8. Older antihistamines. First-generation antihistamines, used for allergies or as sleep aids, can enter the brain more easily than newer allergy medications. This may cause drowsiness, confusion, and temporary memory impairment, particularly in older adults. Point 9. Muscle relaxants. Muscle relaxants can cause sedation, dizziness, slower reaction times, and confusion. Because older adults are more sensitive to these effects, these medications are generally used cautiously. Point 10. Corticosteroids. High doses of corticosteroids may occasionally cause mood changes, confusion, or temporary memory difficulties. These symptoms often improve after the medication is adjusted. Point 11. Parkinson's disease medications. Some medications used to treat Parkinson's disease contribute to hallucinations or confusion in certain older adults, requiring careful monitoring and dose adjustments. Point 12. Certain heart rhythm medications. A small number of medications used for heart rhythm disorders have been associated with confusion or cognitive changes in some patients. Any new symptoms should be evaluated by a healthcare professional. Point 13. The risks of taking multiple medications. Sometimes the greatest concern isn't one medication alone, but the combination of several medications taken together. This is known as polypharmacy, and it becomes increasingly common with age. Every additional medication increases the possibility of drug interactions, excessive sedation, dizziness, confusion, and memory problems. In many cases, several medications with mild cognitive side effects may combine to produce much more noticeable symptoms. Older adults often receive prescriptions from multiple healthcare providers, making regular medication reviews especially important. Bringing every prescription over-the-counter medication, vitamin, and supplement to your appointments allows your healthcare provider or pharmacist to identify unnecessary medications or combinations that may increase cognitive risk. Regular medication reviews are one of the simplest and most effective ways to reduce avoidable side effects while maintaining good control of chronic medical conditions.